Hello and welcome to the MSc Pre-Registration Physiotherapy presentation. My name is Hazel Horrobin and I am the admissions tutor for the course. Whilst it's called the University of Brighton, the course is actually delivered in Eastbourne at the Darley Road campus. It has a wealth of facilities and the picture on the right shows our library. And Eastbourne itself is very accessible both to Brighton, being less than an hour away by train, and also London, where it is about an hour and a half by train. Eastbourne itself is a pretty town, a seaside resort town of around 100,000 people. It's based in East Sussex on the south coast, a mere 19 miles to the east of Brighton. Immediately to our east is Beachy Head, which is the highest chalk-sea cliff in Great Britain, and it lies next to the South Downs National Park and forms the start of the South Downs Way, a coastal walking path that leads between Eastbourne and Winchester. According to the Office for National Statistics, Eastbourne is one of the sunniest and happiest places to live in the UK, and those pictures are my own pictures that show the gardens outside the hotels along the seafront and the pier. The course has its origins in the Chelsea College of Physical Education that moved to Eastbourne from London in the 1940s, but degrees in physiotherapy have been undertaken at the University of Brighton since the 1990s. And now, according to the Guardian University Guide for the UK in 2021, the University of Brighton health professions courses are ranked in the top 10 for satisfaction with teaching and with the overall satisfaction with the course. They also are joint first in terms of career prospects. All of our students find employment. The course is approved and recognised by both the professional body, that is the Chartered Society of Physiotherapy, but also the registering body, and that is the Health and Care Professions Council. It's through registration with them that one is entitled to work as a physiotherapist in the UK. The course philosophy is one of problem-based learning. And that is where students are set problems each week that then define the content that the students will then go away and learn and work on themselves. This kind of learning is very student-centred. It means that you work very closely in groups and in small teams, and that sometimes also includes assessment. It means that as well as understanding the content and the practice of physiotherapy working, you learn to become independent, self-directive. However, it means that the course is extremely intensive. And this is the reason why we present the course in this way. It means that you can apply and hold on to that knowledge much longer. We aim to provide a stimulating learning experience, one that motivates and inspires you to become the best physiotherapist that you can be. By putting your learning and your needs at the very heart of what we do, we also hope that this will drive you towards putting your patient's needs at the very heart of what you do when you're working. The course is intensive and accelerated and runs over 45 weeks in each of the 2 years. This slide shows you a typical studying week in the university, and you can see how busy it is. And this is a picture of the course team at an end of year party. There are 20 of us, physiotherapy lecturers from a variety of specialist areas and with different research interests. In addition to that team, there are visiting lecturers and clinicians, patients and carers, as well as other professionals in the university, as we undertake some shared learning with other courses. All staff are qualified physiotherapists and they have postgraduate teaching qualifications. Some examples of our research is around practice, that is clinical working, physiotherapy education, patient education, pediatrics, neurodynamics, spinal mobilizations, shoulder rehabilitation, exercise provision, and multiple sclerosis. And there is a tradition of staff and student publications, particularly from student dissertations. This is a list of all of the modules that you will need to undertake in order to be eligible for the award of MSc Physiotherapy Pre-Registration. Some of these are academic and are undertaken within the university, and those are the ones that are at level 7. And the others, those are practice placements, and you undertake those in clinical environments and clinical settings, during which you need to achieve 1,000 clinical hours in order to gain registration capacity. It's important to remember that when you are on placement, it is the equivalent of working a full-time job. This is a sample year planner. It's for the year 2021, but you can see the number of weeks that we dedicate to study and the different modules, as well as the placements. Each of the placements is 6 weeks long, 2 in the first year and 3 in the second. And this slide shows our placement area. This is the geographical location of where we have relationships with clinical sites such that we can send students to them. And you can see that actually it is rather large. It is the counties of Kent, Surrey and Sussex. So Eastbourne, you can see, is bottom centre, and then as high as we go to the north is Darrant Valley and Dartford. As far to the east as we go is Margate, and as far to the west as we go is probably Frimley, Leatherhead. And on the south coast we go as far as Chichester. So it's important that you realise just what a big geographical area that represents and what that means for you in terms of living and living costs. The practice-based education is 5 placements, each lasting 6 weeks, 2 in the first year, 3 in the second, and we aim that you gain core experience in community working, neurology, acute care and respiratory, and musculoskeletal physiotherapy. There are optional experiences where you might choose from one of the following: women's health, amputee rehabilitation, burns and plastics, mental health, paediatrics, spinal injuries, orthopaedics and many others, including sports injury. And we are here to help you, we are here to support you. So each student is allocated a personal tutor for their time on the course, and you meet with your tutor to discuss your progress, academic and professional, throughout the course. In addition, student advisory services are on site to help and support you, and that will help you with careers, spiritual and matters of faith, childcare, counselling and well-being, any form of disability support, healthcare and student advice. All students, when they are on placement, near or far, are visited by staff, tutors experienced in coaching and guiding and support whilst you are away from base working on your clinical placements. Our students enjoy the course very much. They like the variety, they like that staff are responsive. In the first year, in the first module, there are opportunities for you to work in the community, undertaking things like pulmonary rehabilitation. And there are opportunities for you to meet students from other years that people often find very helpful in terms of understanding their development and the requirements of the course. They really enjoy the real sense of problem-based learning where real issues are discussed, and they like more focused seminars and practicals. And the timetable is relatively easy to manage, with full days in, 4 days a week generally, and full days off, perhaps just the one, although that's not necessarily a given. It can be full-time. Things are a little bit different at the moment with the COVID pandemic, and so at the moment much of the teaching is online, and we are using Microsoft Teams to offer you a platform of supported learning and tutor contact such that students can continue to learn. But practicals form a very important part of our teaching and your learning, and so all of our teaching rooms are COVID secure. We are fully PPE'd using gowns, masks and gloves such that we can continue to do the practical that is a requirement for the course, but in as safe a way as possible. I'd like to say thank you very much for listening. The course leader is Krishna Galikipati, and I am the admissions tutor, Hazel Horobin. Please contact me with any initial queries. And there is our programme assistant, Claire Carvey, who will be able to help with some of the more technical questions that you might have. Thank you and have a good rest of the day.